I'm very aware at the introduction of this series I said I was coming from the angle of two of my greatest passions, which is the study of self-defence and also the wilderness survival. And we've largely been focusing on examples from the self-defence community of looking at our prioritisation of injuries and self-treating of injuries. So I just wanted to take a quick revisit on the more wilderness aspect of it, again of why we're looking at this training programme, and also to expand on the last lesson of wound management, just to go into a little bit more detail on improvised dressings, which I mentioned back there. So I'm actually down at my Arctic training centre. Arctic, believe it or not, but it's midsummer right now, so we're in the full fantastic midnight sun aspect of living here up in northern Scandinavia. And I'm just doing some general work, and again, these are the sort of things I'm working with. I constantly have a knife with me that I'm using for various tasks. I was working a lot yesterday with the axe. I was doing some work with the chainsaw, and you know, basically I'm out here all on my own. The nearest sort of habitation centre is 10 kilometres away, which doesn't sound very far until you've hit yourself in the leg with a chainsaw or something like that, and then it might as well be the other side of the moon as far as you're concerned. So obviously working with these tools, working with this equipment, I'm being safe, but accidents can happen, and that is where this ability to self-treat becomes essential. So that's just to give some expansion on how it fits in both camps, exactly what we're looking at. Now, I mentioned previously about improvised wound dressings. So this is where we want to sort of, you know, absorb some of the blood or free up the hand to go and actually treat another area, but we need to keep some pressure on that wound. And what we have to think is, you know, in an ideal world, I'm actually prepared for these circumstances. So today, I actually have a wound dressing with me constantly on my knife belt. But if I don't have that, and especially in an urban environment, what sort of things might I have available to me? Well, just as a couple of examples, you know, I might just have the clothing that I'm actually wearing, you know, a t-shirt on or something like that, that I can just remove and basically sort of fold into a configuration that's now going to start working as a dressing for me. If I don't want to start sort of stripping down, or I don't have appropriate clothing items, maybe I have, you know, some sort of handkerchief or bandana with me that can work in an acceptable configuration. And for me, for sort of quick wound dressings, I particularly like to just sort of construct them like this, and then you can tie them off on a wound, whatever the case may be. Failing that, if I'm in a sort of city environment, maybe I've got like a necktie or something similar. The important thing in all of this is we have to have the ability to kind of improvise and adapt. But again, going back to what I said in the previous video, that these are things eminently you can think about and practice prior to ever having to deal with them in real life. This is exactly the sort of thing. Look at what you wear, what you carry with you every day, and start to think, you know, could I use that for an improvised dressing? Or if I had to, how would I best use it? Incredibly powerful training that you can do literally in the comfort of your own home.